Hey, welcome. My name is Rachel Smith, and this is the Natural Health Rising podcast. I am a certified functional diagnostic nutrition practitioner and the owner of Natural Health Rising, which is my online holistic functional medicine company where I help people who have autoimmune diseases, chronic illnesses, mystery symptoms, and a whole host of other imbalances restore their health by natural means. On this podcast, you're going to hear conversations between myself and other health experts on functional medicine and general holistic health. My goal is to provide you with the tools you need in order to help you rise to your healthiest and happiest self.
All right, Carole. So I want to start off with just telling our listeners a little bit about your story. How did you get into medical thermography? And maybe there's a health story background or just a passion or something behind that.
Well, first of all, Rachel, thank you. Thank you for having me. I really want to get the word out about thermography because most people don't know a lot about it. My name is Carole Laney. I own Functional Wellness and Imaging in Medina, Ohio, and I have been in business since 1988. So I got involved with the wellness industry. First, my passion was fitness. And I dove a little bit deeper and started to get thermograms many years ago because I didn't want to do mammograms. I knew the dangers involved in mammograms, and I had one and I chose not to do it anymore. And I got involved in thermography, and thermography actually found that I had a hot thyroid, which led me down the path of doing some thyroid testing, which led me down the path to FDN, which led me into a whole nother world. So it was very exciting. And my husband and I decided that we were going to bring thermography to Medina, Ohio. We're natives here in Medina, born and raised. So we opened the first thermography clinic in Medina, Ohio. We are the only thermography clinic in Medina. And we have the best camera on the market. We have the best camera in the state of Ohio. Actually, we have a FLIR camera, which is from the same company that found the Boston bomber hiding in that boat underneath the canvas. And the thermal imaging camera was attached to the helicopter, and they detected his heat. So we chose to purchase from that company and learn from the best of the best. And that's how we got involved in thermography.
Wow, that is crazy about the camera part. I haven't heard
It
that
is.
before. Yeah. So you said something about the dangers of mammograms. I want to get into that. Can you tell people what are the dangers of mammograms?
And I'm only regurgitating what I've learned from mammographers who
Okay.
are now thermographers, and they are my mentors. And they were involved with mammography and learning about the compression, the 42 pounds of pressure on a breast, on each breast, and also the radiation exposure on a consistent basis, especially when medical industry is asking women to start at the age of 40. And my understanding is they are asking them to do that on a yearly basis. And many are choosing not to. They're choosing alternatives to that compression and that radiation. So I encourage women to do thermography with ultrasound. It's much safer, no compression, no radiation, no pain. And we can tell a lot through heat patterns and coordinating that with the ultrasound.
Okay. So can you explain what is medical thermography?
Yeah, we detect heat patterns in the body. So I'll just use an example of today. So today I had a woman come in, she felt a lump in her right breast. She came in scared, like who wouldn't be, right? And we did thermogram on her and it showed some hot spots in her breast. Can I say that's cancer? I can't say that. The only way to tell if there is cancer is through a biopsy. So a mammogram doesn't tell you if that's cancerous. An ultrasound doesn't tell you if it's cancerous. An MRI doesn't tell you if it's cancerous, nor does thermography. The only way to tell if that's cancer is through a biopsy. So we can detect heat patterns, and if that heat is above 1.5 degrees Celsius, we want to monitor that pattern. If that pattern consistently is getting hotter, that's something that we want to look further into, where we will have you do an ultrasound. I do ultrasound clinics also at my thermography clinic. We have this gentleman come twice a year. So doing these clinics, these women can go have an ultrasound done and look both at the thermogram and the ultrasound, and then take that to a breast specialist. So if we see an elevated level of concern on a report, that's where we say, you know what, you need to go see a breast specialist. And then the breast specialist is going to put them through that gamut of mammogram, ultrasound, MRI, biopsy. We always tell the women, you know what, it is your body. You tell them no. You tell them, I would like to go ultrasound, if you haven't already done that, or straight to a biopsy. Here's the problem though, Rachel, with a biopsy that a lot of people don't know. So I've never had a biopsy. I've spoke with a lot of women that have, and they say it's like a harpoon needle that they stick into you. And then when they pull that needle out, there's also that risk of those cancer cells just metastasizing, exploding, right? So that's frightening in itself.
Yeah.
But that really is the only way to tell if that tumor is cancerous, is through a biopsy. Now, with thermography, I'll use another example, and you know this well because you're an FDN. What do we see a lot of? We see a lot of gut dysfunction, right?
Right.
So, and that's the oral health and gut dysfunction. Let me backtrack a second. If you have a root canal, and we look at oral health as FDNers, right?
Mm-hmm.
If you have a root canal, 93% of breast cancers have root canals, usually on the same side. Let me backtrack one more time to that lady that came in today, that she does have some hot spots. She does have a lump. Guess what she has on that right side?
A root canal.
Right?
Mm-hmm.
I mean, we could go and do a whole nother podcast on that, right?
Right.
But we're looking at oral health. So we're looking at hot spots. We're taking, just as we are as FDNers, we're taking their health history and we're putting this all together. So I'm putting this together as an FDN, and I'm putting this, all their health history with all their hot spots. How hot is that spot? Is it getting hotter? That's not my job. That's the interpreting physician's job. However, when I get the report back, that's my job as an FDN to say, where do we go from here? Do we need to test for different food sensitivities? You know, do we need to do the Dutch test and see what's happening with estrogen levels, with cortisol levels? So that's the beautiful thing about learning about FDN and putting that with thermography. It's like a whole different world. But we can learn a lot about gut dysfunction. We can see how the liver just lights up like a Christmas tree. We can see how the spleen, if they're having any issues, the spleen will light up. We can see the whole lymphatic chain to see if there's congestion. Women that are wearing aluminum deodorant, you can see that trail all the way down into the abdomen. It's phenomenal, the things that we see. I absolutely love it. I love talking about it. Most people have no clue what thermography is.
Wow. I'm amazed. Okay.
You come to Ohio, you come to
Yeah, I want to fly out there now and get some thermography from you.
anytime.
Okay, I have a lot of questions. So let's backtrack to the breast cancer part. How often, or is there an accuracy? I know you can't say that there's a direct connection necessarily, like, oh, you're finding it at a certain heat point or hot spot, and like this is cancer. I know that's not the diagnosis, but how consistent do you see something and in your head you're like, oh, that's cancer, and then the person goes and gets the biopsy and it is cancer? Can you speak to that?
I see it.
Yeah.
I know it. I can say without a doubt that woman that I had in my office today,
Yeah.
breast cancer.
Okay.
I can't tell her that.
Right.
I can't. I'd lose my license.
Yeah.
But in my heart, I know. I've seen enough. But I saw the fear in her eyes and the tears. She came with her husband, and I think she knows. Here's another thing I learned, Rachel, that I didn't know. And I learned this from an ultrasound tech. and I'm only telling you what she told me, but when you're pressing on a lump, a bump, a cyst, whatever you're finding in the breast, if it's painful, it's probably not cancer. Now, wouldn't you think the opposite?
Yeah.
So if it's not painful, chances are it is cancerous. That woman that came today, she could pinpoint right where that lump was, and it's not painful.
Mm-hmm.
So when I hear clues like that, and again, like, as an FDN, we're always listening. We're listening to what they're saying, and how does that correlate to what's happening in their body? That's, people just really need to play health detective with themselves, because they would really figure it out pretty quick what's happening. But when we start talking to people and, okay, I have a lump, I'm pushing on it, it's not painful. I have a root canal on that side. I have a history, which really is only 5 to 7% history. So when somebody tells me they have breast cancer history in their family, I don't freak out on that, because it really is only 5 to 7%.
Mm-hmm.
I also want to know what their lifestyle is. That plays a big part. I also want to know if they know their vitamin E level, their vitamin D level. I want to know if they know all of those levels, because most breast cancer patients are really low in iodine, vitamin E, and vitamin D.
Okay.
Those are all really important things. And just to throw this out to you too, if you're into Designs for Health supplements, they have some amazing products. So if people do suspect maybe that they have cancer, doesn't have to be breast cancer, they are phenomenal, that company is. I just met with the rep today, and we just discussed some supplements. But for breast health, every woman needs to be on a really good source of vitamin D. They need to be taking vitamin E, and they really need to look at their iodine levels.
Mm-hmm. Yeah, that's not looked at very often. Iodine, not at all.
Really not.
Mm-hmm.
Another thing, can we talk about COVID?
Yeah,
Okay.
I think. I hope it doesn't get taken down.
Let's call it C, okay? I know, right? That's frightening. It's very frightening. Our interpreting physicians, I upload the reports to interpreting physicians, and we have many interpreting physicians. Dr. Christine Horner is a breast specialist. She's one of our interpreting physicians. So we do have the best of the best looking at these images. What they're finding is the inflammation in the body, whether or not you've had the injection or whether or not you've gotten the virus naturally, that everyone's inflammation heat is up by about 2 degrees. That's a lot.
Yeah.
So the spike protein is really creating some havoc. We also ask people, if they have been injected, to wait at least 3 months before they come in, because we're seeing a lot of swelling in the lymph nodes, which could be giving a lot of false positives. So yeah, this spike protein that's out there is really wreaking some havoc.
Yeah, just totally triggering some inflammation in the body.
Mm-hmm.
Yeah. With the root canals, are you checking thermography wise on their jawbone? Do you do that to see if they have like a cavitation in the jaw?
Yeah.
That what you're looking for?
And they're by specific studies. So if someone calls my office and says, I want to do a breast study, I'm like, do you really just want to do a breast study, or do you want to do a women's health study? Because the breasts are attached to us, and the problems that we're having are created by oral or gut. So if we're just looking at the breast, we're really not getting the whole picture. However, I did have a couple breast studies come in today. I personally am looking at the heat in the thyroid. I'm looking at the heat in the carotid arteries. I'm just doing that as a thermographer. I'm not doing it as an interpreting physician. But I start to ask questions. Do you have any metal amalgams? Have you had them removed safely? Do you have root canals? And I will document that in their breast study, even though they did not come for a head neck study or a women's health study. I'll still document, because that's pertinent information for that interpreting physician, especially like the one that I gave you today for the example. She did have a root canal. She came in for breast. However, those are the questions I asked. And I documented that
Mhm.
as her thermographer, because that's important to know.
Yeah. What is a women's health? Like, what are all the areas that you would check?
It's from the top of your head to your waist.
Okay.
And a full body would include your extremities, your hands, your feet. So we don't do that too often unless somebody has diabetes, or we get somebody that was in a car accident and maybe the attorneys want to see what's happening in their body. We'll do a full body with that. Or if somebody has just, tennis elbow and they want to know what's happening with that tennis elbow, is it radiating into the shoulder? What can we do for that? And, with my background in fitness, that's where I can go in and say, well, let's do A, B, and C along with, D, E, and F. So that's the beautiful thing of being well trained in a lot of different modalities.
Hmm. What are some of the most common things you find on the thermography? Is there like a specific thing that stands out? Go ahead.
A lot of gut dysfunction, a lot of
Okay.
livers that need detoxified. Yeah, you can
Okay.
see that. And that's common for everybody, isn't it?
Yeah. So what would you do as a practitioner then? So you find you look at their gut, you see it's all inflamed, or there's a lot of heat on it in the liver as well. What would be the next step for that person?
Well, they would have to probably go through some testing. If they wanted to come to me for testing, I would order a variety of tests. And the first thing I would have them do is castor oil packs. They're so basic, so easy, and they
Yeah.
really do work. I talk to them about sauna. Everybody needs to be on a rebounder. I talk to everybody about rebounding. You can get them at Walmart for less than $50. Everybody needs a rebounder. And if you don't have one, just simply do some jumping, do dancing, whatever, right?
Yeah.
Dry brushing is really important. So I carry dry brushes in the office, and if they don't buy one, I'll give them one, because everybody needs to be dry brushing. So after everyone leaves the office, I send an email out with some links in it just for biological dentists, for how to dry brush, for some testing that I would recommend. A lot of YouTube videos out there that are really good for people, meditation videos. We're seeing a lot of anxiety with what's been happening in the world nowadays. And that all plays a part with the stress in the body and what we're seeing.
Absolutely. What kind of testing would you tell those people to go do?
Well, if it was a woman that had some breast health issues, I would definitely do the Dutch. I love the Dutch. I would do heavy metal testing. It depends. It really depends on the scenario, and it depends on what that interpreting physician is reporting back to us. The beautiful thing about some of our interpreting physicians is that they will guide them toward a functional wellness. They will say, maybe you should see your thermographer about this, or maybe you should see your functional wellness practitioner about this. So the report is going to guide that client, and then that client in their free 15-minute phone consult to go over that report will then guide me in where I need to lead them. I love playing health detective with them, though. It is so fun.
Yeah, that's the most fun part of the job.
I know, right?
Yeah. Okay, so what happens when if someone decided to work with you, and they do some testing with you? Now, do you like coach them through a whole FDN type protocol?
I do. Yeah, the
Okay.
same, everything that we've learned. They can sign up. They can do the testing. They can sign up with me for 3 months. They can just go over the tests and decide what they want to do there. I'm not one that says, okay, here is 8 weeks that we have to do A, B, and C. Most people won't. They won't. People are too busy. They're just too busy. But if I can say, let's do this test, let's look at this test, let's get on some supplements, let's talk about dress, right? Diet, rest, exercise. We go through all that, sleep, supplements. People pop in the office, Carole, could you do my blood pressure for me? Yeah. We'll go through all that stuff. It's very basic. It's just, what are you eating? I don't know if you're in with that Designs for Health, but if you're not, Rachel, get involved and get your clients on that, because that Well World app that is free is amazing. It's an amazing app. So definitely look into that. If your listeners don't have the D-Minder app downloaded, It's free. Download it. Sunlight is so important. You're in Florida, right?
I used to be. I'm in Arizona now. So
Oh,
same super sunny state. Yep.
there you go. So you're getting that every day. I'm in Ohio and it's pouring down rain right now, and we're getting hail, and we never see the sun in Ohio. So whether even if you're supplementing, you're still low in D because you're not getting that sunlight.
Mhm.
But yeah, just going through the regular dress protocols. And I think that once people start to learn what they should be doing, they start to heal. But they got to want
Yeah,
to do it. You got to put the time in, got to put the effort in.
that's right. And yeah, for people who don't know, DMinder is a really cool app where every time you set your location, every time you go outside, you set, how much skin is being shown to the sun, and it'll tell you basically how much vitamin D you're getting. So yeah, of course, if you're in Ohio and it's snowing, it's going to be very different than out here in Arizona. But it's really just great to keep track of and just know where your levels are at.
Yeah,
So
it's so important.
yeah, and so let's say a lot of the people that come to you, have you dealt with a lot of women who have breast cancer?
Yes.
Okay. What are some standard things when it comes to nutrition, and then some other things that you would do lifestyle wise for someone who has breast cancer?
No sugar, no alcohol.
Okay.
Those are the two primary things. And what did everybody start doing a lot more of during the lockdown? They started drinking a lot more.
So much.
Right. And they were working from home, and, it's 4 o'clock. Let's have a glass of wine. That glass of wine turned into 2 or 3 glasses of wine, and it became consistent. Alcohol and sugar, primary cancer causing. I mean, we know environmental factors. I mean, we could talk for hours about all of that, but cancer, we're seeing processed foods. We know all that, right? It's the basics. We know that. But it's alcohol and sugars.
Okay. Are you in a certain camp when it comes to like veganism, animal protein, any of that stuff with the breast cancer?
Colorful vegetables. Some people want, they're vegans or vegetarians. I'm a protein girl. I'm a grass-fed.
Me too.
I'm a really good quality chicken. I'm not a pork girl. I'm not into pastas and breads and dairies, and that's not my lifestyle. But yeah, if somebody comes to me, I would definitely get into that Well World app and make it more specific to them based on what Designs for Health is suggesting. I really am learning a lot from that company. And I encourage everyone to find someone who can educate them on the quality supplements. And I can't say it enough, but vitamin E, vitamin D, and iodine for breast health.
Okay. When it comes to iodine, because I know this is a controversial topic when it comes to the thyroid. So maybe let's get into that a little bit. What are your thoughts?
This is what I was taught when I first started thermography, is tell your people to go get some iodine over the counter at your local drugstore. Draw a little square on the upper part of your arm before you go to bed. And if you notice 24 hours later, that square is gone, your body absorbed that, the skin is the largest organ. Continue to do that for a couple days until you see that square is still there. Mm. So your body is taking in what it needs. It's absorbing that. Once you see that square is still there, you're not deficient. Whether or not that's true, Rachel, I don't know. I believe it. I tell my people to do it. People do it.
So are you having them supplement with a specific amount of iodine?
No, I'm not. I tell them just to try and eat the seaweed. Have you ever seen the seaweed products that are out there?
Oh yeah.
Find a nice clean seaweed product. And as far as the thyroid, I encourage everyone to eat some Brazil nuts every day because we know that everybody is low in selenium. So I suggest just eat a couple Brazil nuts every day. But I'm a stickler too about them running a full thyroid panel. I think that's so important.
Yeah. Yeah. A full thyroid panel, not 2 markers.
Yeah. Yeah, and we're also seeing the thymus light up like a Christmas tree too. And your thymus is that gland that really has everything to do with your immune system. So I tell people, thump your thymus. You're on your thymus when you start to vibrate, when you go and you hear
Okay.
that vibration.
Yeah.
That's when you're on your thymus. So it's really important on a daily basis. I don't care if you're, my 4-year-old grandson, you be thumping your thymus like King Kong on a daily basis. And I tell, moms, if your kids are sick, thump their thymus, teach them how to do that because it's really good for their immune system.
Right. Yeah. That's a great point. That's part of, I do tapping with people. Do you ever do EFT? That's one of the points that I love to hit is the thymus. Yeah.
So important.
Mm-hmm.
So important.
Anything that's like top of your mind that you really want to speak about? I mean, we've gone through like what is thermography and some major things you see, but anything specific you want listeners to know?
I just think everybody should find a good thermographer, somebody who has a really good camera. 640 by 480 resolution is ideal. Ask about the camera. If anybody has any questions, they can always email me and I'd be happy to send them just a little picture with all the questions to ask thermographers. I know you got some good ones in Arizona because one of my mentors is out there in Arizona. Her name is Carole Laney. So if you need a thermogram, you go see her because she has the best camera and she's using our interpreting physicians. So yeah, get a thermogram.
Okay. How often should people get these?
Once a year.
Okay. And can you run through maybe just a couple of those questions if I'm going to go look for a thermographer, what those are?
You want to know how long have they been doing it, who their interpreting physicians are, how often is their camera calibrated, what kind of camera do they have?
Okay.
Yeah.
How often do you have to calibrate the camera?
Usually every 2 years. You send it in for calibration. You have to calibrate it more if you're moving around. I don't move around. I have my own office, so my camera stays there. But if I would be putting it in and out of my vehicle to travel to chiropractors and that, I would say you would have to do that.
Okay.
Often.
Yeah. Oh, I can't wait to go look up an Arizona thermographer.
Yeah.
You said her name was what was her name?
Carole Laney, Conti.
You guys have the same name.
Carole
Okay.
Laney. Yeah, she's in Cottonwood.
Okay. Awesome.
That might be a distance. I'm not sure. Arizona's pretty big.
Yeah.
We'll find you somebody.
Yeah. Yeah. Okay. So I always like to ask if you could leave the listeners with one action that they could take this week to help them live a healthier, happier life, what would that be?
Wow, that's a good question. There's so many things. I would say make sure, can I say a couple things? I would say make sure you're getting vitamin D every day and make sure you're sleeping good, solid sleep every night. I think those are really important. I mean, there's so much, Rachel, hydration, food. I mean, I could go on and on, but I think your vitamin D is so important, getting sun and getting sleep.
Mm-hmm.
Waking up in the morning, getting that sun in your eyes, going to bed at night, looking at that moon, and getting a good night's rest. I think those are two really, really important things.
Yeah. Any other tips on sleep specifically?
We could talk about turning your phones off and, making it really dark and, making sure the Wi-Fi is not on at night,
Yeah.
It's, my biggest tip for sleeping is 2 top sheets, not just one. I've always lived with 2. I've been married for 40 years and we have 2 top sheets on our bed all the time. And I tell you, that's the ticket to get with a heavy weighted blanket on top of you. I think that's really, really good sleep.
Mm-hmm. Yeah. I sleep with a really great heavy weighted blanket. I'll put it in the show notes actually, because I got it recently this past year and it just totally changed the game for me for sleeping. Because you just feel like super cuddled and you just pass out.
So
and good. Yeah. And then what you said about the Wi-Fi too, that's super important. I think most people don't know that, like don't understand that you shouldn't have your Wi-Fi on or in your room or like a lot of electronics plugged in because of the EMFs. it really actually does affect your sleep. We know that for a fact. So yeah, that's a big one.
Yeah. Well,
Yeah.
thank you though. Thank you so much for letting me, just enlighten your listeners about thermography, because people, they don't even know how to pronounce it. They've never heard of it. And when people reach out to me, I'm like, I just want to share it with everyone. It's so important. When you have your first thermogram, you will be blown away by what you see and learn about your body.
Yeah. Well, thank you for taking the time to chat and being on the show. If you want to share anything additional, go ahead. And then otherwise, you can let people know, like, how can they reach out to you, or if they want to work with you and learn more.
You can reach me at medinathermography@gmail.com, or you can go into functional wellness and thermography.com, or just call me at 330-948-3488. I'll pick up the phone and talk to you.
All right. I'll put that in the show notes for everybody too.
Okay, perfect.
All right. Thank you, Carole.
Thanks, Rachel.
Thanks for watching the episode. I really hope you enjoyed it. And if you did, make sure that you like the video and leave a comment and share it with a friend who really needs to hear it. Because when you share this information, you're also going to help other people level up their health. And if you or somebody else you know wants to work on their health and they're looking for a functional medicine practitioner, feel free to reach out to me to apply to work together. Thanks for watching, and keep striving to become your healthiest, happiest self.